Hi there, I'm Tony Lee, and this is Hot Flasher, your daily menopause podcast that serves up fresh news, research, and wellness tips. I've built a daily news pipeline to find the latest on women's health and menopause research. Allow me to introduce my co-host, Nikki, who handles the headlines. Take it away, Nikki.
Thanks, Tony. We've got some eye-opening research today. I'm starting with something that honestly made me a little frustrated when I read it. There's new research out showing that psychotherapists are routinely missing a huge piece of the puzzle when it comes to women's mental health. The study, published by Engel and colleagues, found that reproductive health factors, including menopause, are being overlooked in routine psychotherapy care. Now, if you've been listening to this show for a while, this probably doesn't shock you. How many of you have sat in a therapist's office talking about anxiety, depression, or mood changes without anyone asking where you are in your reproductive journey? I'm guessing quite a few. What's particularly concerning about this research is that it confirms what many of us have suspected. There's a systematic blind spot in mental health care. Therapists are trained to look at family history, trauma, life stresses, all important factors. But they're not consistently asking about perimenopause, menopause, or how hormonal changes might be affecting mental health. This matters because we know hormonal fluctuations can significantly impact mood, anxiety, and cognitive function. A woman dealing with perimenopausal anxiety might benefit from understanding that her symptoms could be partly hormonal, not just psychological. That doesn't mean hormones are the only factor, but they're a factor worth considering. The researchers are calling this a gap in routine care that affects millions of women. And they're right. When your mental health provider isn't considering your reproductive health status, you're not getting complete care. So what can you do about this? When you're working with a therapist or counsellor, bring it up yourself. Mention where you are in menopause, what symptoms you're experiencing. When they started, don't assume they'll ask. Many won't, not because they don't care, but because they weren't trained to think about it systematically. Moving on to some more encouraging news. There's new research on acupuncture for women dealing with treatment-related menopause symptoms. This study, led by Amato and colleagues, looked specifically at women with breast cancer who are on endocrine therapy. If you're not familiar with endocrine therapy, it's a treatment that blocks or lowers estrogen levels to prevent hormone-sensitive breast cancers from returning. It's life-saving treatment, but it can trigger intense menopausal symptoms, hot flashes, sleep problems, mood changes, and many of these women can't use hormone therapy because of their cancer history. This study followed women through a course of acupuncture treatments and measured their hot flash frequency and sleep quality before and after. The results were pretty compelling. Women experienced significant reductions in both hot flash intensity and frequency, and their sleep improved measurably. Now, this wasn't a randomized controlled trial. It was what researchers call a pre-post study, meaning they compared the same women before and after treatment. So we can't rule out placebo effects entirely, but the improvements were substantial enough to be clinically meaningful. What I find particularly interesting is that this gives women in a really challenging situation another tool to consider. If you're dealing with treatment-induced menopause symptoms and hormone therapy isn't an option, acupuncture might be worth discussing with your oncology team. It's generally safe, and this research suggests it could provide real relief. The sleep improvements are especially noteworthy because sleep problems can cascade into so many other issues: mood problems, cognitive difficulties, fatigue. If acupuncture can help break that cycle, that's valuable. Now, for something that caught my attention because it represents a completely different approach to treating hot flashes. There's new phase 2 trial data on something called GS1144, which is a neurokinin 3 receptor antagonist. I know that sounds like a mouthful, but stay with me because this could be significant. This study was conducted in Chinese women with moderate to severe hot flashes. It was a proper randomized, double-blind, placebo-controlled trial, the gold standard for testing new treatments. And the results were promising. Women taking GS1 144 had significant reductions in both the frequency and severity of their vasomotor symptoms compared to women taking placebo. What makes this interesting is the mechanism. Instead of targeting estrogen receptors or trying to replace hormones, this drug works on neurokinin 3 receptors in the brain. These receptors are involved in temperature regulation and seem to play a role in hot flash triggers. The researchers found that GS1 144 was well tolerated, which is always important when you're looking at new medications. Side effects were manageable and similar to placebo in many cases. Now, this is still phase 2 research, which means we're probably years away from this being available. If it ever makes it to market, drug development is a long process, and many promising treatments don't make it through phase 3 trials. But it's encouraging to see researchers exploring different pathways for treating hot flashes. This approach could be particularly valuable for women who can't use hormone therapy or who haven't found relief with existing non-hormonal options. Right now, the non-hormonal prescription options are somewhat limited. There's paroxetine, gabapentin, clonidine, and a few others, but response rates vary, and side effects can be problematic for some women. Having more options in the pipeline means more women might eventually find something that works for their particular situation. And I appreciate that researchers are thinking beyond just trying to replace estrogen. They're looking at the actual mechanisms of hot flashes and targeting those specifically. What's also worth noting is that this research was conducted in Chinese women. Sometimes drug responses can vary between populations due to genetic factors, so it'll be important to see how this performs in diverse populations if it moves forward in development. All of this research points to something I think about often: how much we still don't know about women's health and how much room there is for improvement in how we approach these issues. From therapists who aren't trained to consider reproductive health, to the need for more treatment options for cancer survivors, to the complexity of developing new approaches to hot flashes. But I'm also encouraged by the fact that researchers are asking these questions and looking for answers. Each of these studies represents someone recognizing a gap and trying to fill it. Are you finding that healthcare providers in your life are connecting the dots between your reproductive health and your overall well-being?
Thanks for listening to Hot Flasher. We're back tomorrow with more, so don't forget to subscribe. See you tomorrow.